Best Medicare Supplement Plans. If you're researching Medicare and want to know which Medicare Supplement plan may be right for you, this is the video that you'll want to see. By the end of this video, well, before the end of this video, you'll know which Medicare Supplement plan is right for you. So stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance broker helping people with their Medicare and retirement needs in 49 states, from Hawaii to Virginia and Alaska down to the Florida Keys. We are a true independent insurance broker. Now that means that we work with all the major insurance companies and offer all the Medicare supplement plans. Most of all, we represent your best interest, not that of any insurance company, and our services are free to you, the consumer. So check out our 5-star ratings, then contact us. You'll be glad you did. There are a number of videos with headlines like this one. What is the best Medicare supplement for 2021 or 2022, and so on. This one, like all my videos, will be different than any that you've seen to date. I'll help you identify which Medicare supplement plan you'll be happiest with, and I'm going to accomplish this without showing you a table of benefits and pointing at deductibles and copays and such. That's just not necessary. So let's first address the elephant in the room. The fact is there are no bad Medicare supplement plans. Every Medicare supplement plan will do exactly what Medicare tells it to do. If you're watching this video and you've already decided to go with a Medicare supplement plan and not a Medicare Advantage plan, then I congratulate you. You've already made the most important decision facing those who are new to Medicare. If you haven't made up your mind, I invite you to watch my New to Medicare series of videos where I go through the Medicare Advantage plans, Medicare Supplement plans, Part D, and more. Now, you'll find this series on my website, MedigapSeminars.org, or by subscribing to this channel. People who choose the Medicare supplement route do so because they get to keep the two most important benefits of original Medicare. What are those benefits? First, you're not limited by a network with a Medicare supplement plan. You can see any doctor, go to any medical facility in the United States or its territories as long as they accept original Medicare. That's almost every doctor and medical facility in the country. Second, no insurance company has a say in your health care. Medicare's intent is to cover everything that's medically necessary, and they lean on your doctor to determine medical necessity. Your health care decisions are between you and your doctor. Keeping those two benefits of original Medicare are overwhelmingly the deciding factor for those who choose a Medicare supplement policy over a Medicare Advantage plan. You get to keep the benefits of original Medicare regardless of which supplement plan that you choose, or even which insurance company that you decide to go with. They all keep original Medicare as your primary insurance, so if all the Medicare supplement plans are good, which one's the best? Perhaps the better way to word that question is which plan is right for you. If you've seen a Medicare supplement plan benefit table, you know there are a lot of plans to choose from. Thankfully, for most of this country, there are really only a few plans that are priced such that they're a reasonable value for the premiums that you pay. Now, these are usually Medicare Supplement Plan G and Medicare Supplement Plan N. In some parts of the country, there's another plan that you should consider, and that's called the high deductible plan. In this video, I'm going to show you how to identify which of these plans is right for you. Let me pause for a moment and note that I am very aware there's some of my competitors that want you to think that one plan is going to increase in price drastically more than the other. No. It's not the plan, it's the insurance company. Some insurance companies will have high price increases regardless of the plan. Some will not. In fact, in my next video after this one will be on how to research Medicare Supplement insurance companies. Now, this will be put out within a couple of weeks when this is published. And if you want to be notified when it's published, just make sure that you're subscribed to my channel, the YouTube channel, and hit the bell icon so that you'll be notified as soon as it's public. So let's start with the simple but bold assertion. The debate between a Medicare Supplement Plan G and Medicare Supplement Plan N is not one of benefits and cost, but of personality, your personality. So let me show you. Medicare Supplement Plan G offers the most health insurance coverage of any Medicare supplement that's available to those who are new to Medicare. With a Plan G, you can spend a year in the hospital as an inpatient and it won't cost you a dime. Your inpatient services are covered 100%. With a Plan G, your only expense for the inpatient and outpatient Medicare bills is the annual Medicare Part B deductible. The Part B deductible for Medicare outpatient services is when you see a doctor as an outpatient for the first time during the calendar year, you'll pay that deductible. Once you've paid that deductible, you have 100% coverage. As I make this video, the Medicare Part B annual deductible is $203. It's for 2021. That's all. The Part B deductible will change every year, just a little bit. Medicare stated a target of about $250 for the deductible sometime in the next 4 or 5 years. So you pay the deductible once a year when you first see a doctor for outpatient services. After that, everything is covered 100%. That's why I call it the peace of mind plan. The people who are happy with a Medicare Supplement Plan G just want great coverage so they don't have to think about their health care. It's just paid for. It offers complete peace of mind. To the person who chooses a Medicare Supplement Plan G, that peace of mind coverage is more important than the extra money it costs relative to your other Medicare supplement choices. It's that simple. So let's compare that to the Medicare Supplement Plan N. A Medicare Supplement Plan N has less insurance coverage than the Plan G, and it costs less. But there's a catch beyond just the lower premium. People who choose a Medicare Supplement Plan N like to save money and do not mind participating or taking responsibility in order to save money. Now, we need to look at this closely to fully understand. A Medicare Supplement Plan N is just like the Plan G in that you can spend a year in the hospital and it won't cost you a dime. You have 100% inpatient coverage. Also like the Plan G, you'll have to pay the Medicare Part B annual deductible when you first see a doctor during any calendar year. That's that $203 outpatient deductible. But here's where this plan is different. With the Plan N, whenever you see a doctor for a diagnosis or evaluation, you'll pay up to a $20 copay. It doesn't matter if it's a primary care doctor or a specialist. It's no more than $20. If you go into an emergency room, there's up to a $50 copay that is waived if you end up staying as an inpatient in the hospital. Now, this is important, and it's often misunderstood. The $20 copay is for diagnosis and evaluation visits only. There's no copay for physical therapy. There's no copay for when you get a flu shot. There's no copay if you end up with cancer and have chemotherapy infusions once a week. There's no copay for telehealth meetings, and there's no copay when you go to an urgent care center. The copay is only for an in-office visit for diagnosis or evaluation. When you go to a doctor's office to find out what's ailing you, that's a meeting seeking a diagnosis. When a doctor has you trying a new prescription or other treatment, and you meet with your doctor at their office to see if that treatment is working, that's an evaluation. Those are the meetings subject to the copay. Small copays are really not a big deal, but here's the catch. The biggest weakness of a Plan N is that there's no insurance against something called a Medicare Part B excess charge. Excess charges are very easy to avoid, but it takes a little effort on the part of the consumer. But avoiding that excess charge is very important to the plan and policyholder. And the reason is that a person is, if they're charged a significant excess charge, it's going to wipe out any savings that you've received by having a lower premium. So the person who has a Plan N can easily avoid an excess charge by looking up their doctor on the Medicare.gov website. I'll talk more about this in a second. First, what is a Part B excess charge? When a doctor decides to work with Medicare, they can choose one of two different contracts. More than 97 out of 100 doctors choose what's called a participating provider contract, and here's why. As a participating provider, Medicare sets the prices for every procedure and service. Medicare assigns the rates so the doctor knows exactly what they'll get paid for every procedure. In addition, Medicare becomes their one-stop biller. In other words, the doctor only bills Medicare. Medicare pays its portion and then immediately notifies the supplement company and instructs them on what to pay and when and who. The supplement company does what Medicare tells it to do. Now, doctors like this because it's cost-effective and provides a steady cash flow. The doctor gets paid quickly, usually within just a few weeks, and Medicare takes care of everything. Some doctors, fewer than 3 out of 100, decide they want to charge their patients more than what Medicare pays them. Medicare allows them to have a contract that permits them to charge up to 15% more than Medicare's assigned rate. That 15% is called an excess charge. Some states outlaw this excess charge completely, but even outside of those states, very few doctors will choose a contract that allows them to charge more than the rates that Medicare assigns. As I mentioned, only 3 out of 100 doctors will take this contract. Why? Well, because Medicare discourages this contract by doing two things. First, they pay that doctor only 95 cents for every dollar that they pay the participating providers. Then the doctors can charge up to 15% more on that 95%. 15% of 95%, which is really just 9.25% more than they would make if they were a participating provider. Second, and most importantly, Medicare will not be the doctor's one-stop biller. The doctor must bill Medicare, but Medicare will not notify the supplement company. Keep in mind, the doctor cannot bill the Medicare supplement company either, because the doctor has no contract with the Medicare supplement company. What the doctor does instead is they ask you, the consumer, to pay up front and be reimbursed by the Medicare supplement company. You pay up front, then you send the bill to the supplement company to get your money back. This is not exactly consumer friendly. Very few doctors find it's worthwhile. Still, it's your responsibility to avoid excess charges if you choose a Plan N. People who choose a Medicare Supplement Plan N do so because they like saving money. But if you're going to have a Medicare Supplement Plan N, you must avoid being charged an excess charge, because an excess charge can wipe out what you've saved with your lower premiums. Now, it's easy to avoid. It's easy to avoid doctors that charge an excess charge, but the burden is on you, the consumer. You must look up your doctor on the Medicare.gov website before you visit them for the first time. The Medicare.gov website Physician Finder will indicate if the doctor accepts Medicare assigned rates and cannot charge an excess charge, or if that doctor has a contract that allows them to charge an excess charge. Now, getting back to the personality types. The person who's best fit for a Medicare Supplement Plan N is the person who wants to save money and enjoys participating or taking a small responsibility in order to save that money. It's the person who might enjoy using coupons, for example, or maybe drive a few blocks out of the way to save 10 cents on a gallon of gas. And by the way, if you're not 100% sure which plan fits you, I'd like to add one other thought here. Medicare Supplement Plan N can save a person, well, typically between $15 and $50 a month in premiums, depending on where you live. When you compare the cost versus value of a Medicare Supplement Plan G and Plan N, measure the price difference in office visit copays. Now remember that $20 office visit copay? How many office visit copays per month, each month, would it take for Plan N not to be a better value than the Plan G? The answer to that question helps a lot of people make up their mind. Again, both are good plans, and they're just for people with different personalities. People that want peace of mind coverage value that peace of mind coverage over the higher premium costs. People that want to save money are bothered with the higher premium more than by the simple act of looking up their doctor to make sure they don't charge an excess charge. Tell me, which are you? Do you prefer a peace of mind, the peace of mind of a Medicare Supplement Plan G, or are you interested in saving money with a Medicare Supplement Plan N? Please let me know in the comments section below. Just write, I'm a Plan G person or I'm a Plan N person. What I want to do is tally them up over time and see which personality is more common. Now, I have a pretty good idea just based on my experience, but this is a great opportunity to get some hard data. So please, lend me a moment of your time and let me know in the comments below. And when we have enough votes, I'm going to tally them up and pin them to the top of the comments section so that you'll know too. Then call my office and complete a quote request, and we'll send you a quote for the insurance company that I recommend in your area. My intent when we make a recommendation is to help you into the insurance company that should offer you the lowest cost over your lifetime. So hopefully, now you know if you're a Medicare Plan G personality or a Plan N personality. Now, if you're still not certain, I have 2 detailed videos comparing Medicare Supplement Plan G versus Plan N that include a lot of other details. And you're going to find them by subscribing to my channel or type in hashtag MedigapSeminars.org into the YouTube search bar. Next, as I promised, I'm going to talk about the high deductible Medicare supplement and how to tell if it's something that you should consider when deciding which is the best Medicare supplement plan for you. The interesting thing about a high deductible plan is that the people who choose this plan are not a separate personality than the 2 I just described. They choose this plan when it's an overwhelmingly better value, a no-brainer is what I call it. So what is a high deductible Medicare supplement? Well, there are 2. There's the high deductible Plan F and the high deductible Plan G. They're the exact same plan with the exact same plan benefits, and they should be the exact same price from whichever insurance company is offering it. The easiest way to understand a high deductible Medicare supplement plan is that it simply places a maximum annual out-of-pocket on your original Medicare Part A and Part B benefits. You should think of the Medicare supplement deductible as your maximum annual out-of-pocket. So the current deductible is $2,370 for the year 2021. It changes each year based on your Social Security cost of living index, your COLA. With a high deductible Medicare supplement, Medicare Part A and Medicare Part B, original Medicare is your primary insurance. You have all the benefits of original Medicare. You'll pay the deductibles and the co-pays of the Medicare Part A and B up to the point where you've spent $2,370 in any calendar year. That's it. After that, you have 100% coverage. So how do you determine if enrolling in a Medicare high deductible supplement is a no-brainer or a great value? Easy. When the annual cost of your full coverage Medicare Supplement Plan N or the Plan G is close to or greater than the amount of the deductible. If you live in an area of the country where supplement prices for a Plan N or a Plan G are expensive, where the plan and premium is $160 a month or more, then compare the premium of a full coverage Medicare supplement to the deductible, which is the maximum annual out-of-pocket with your high deductible supplement. If you don't live in a high-cost area, compare the difference in premiums between a full coverage Medicare supplement and a high deductible supplement with the Medicare Part A deductible. In other words, compare your savings by having a lower premium with a Medicare high deductible supplement to the amount that you're at risk when you go into a hospital or have a medical event. So that's the amount that you'll have out of pocket with just a few days hospital stay. So let me explain a little better here. There are areas of this country where the premium for Plan N is plus or minus $200 a month. That's $2,400 a year, whether you see a doctor or not. Think about it. The mandatory annual premiums for a Plan N or a Plan G in some areas of the country are equal to or greater than your maximum out-of-pocket with a high deductible plan. Most people don't reach that maximum out-of-pocket but a few years in their lifetime. Why not spend $50 a month plus or minus in premiums and then only $2,400 in a worst-case scenario in a year where you've had a lot of health issues? If this is a little confusing, by the way, I have an entire video on the high deductible Medicare supplement plans. It's going to be linked above and below. So another way to look at it is this. If you live in an area where the annual cost of your full coverage Medicare supplement plan is close to the annual deductible of a high deductible Medicare supplement, you should consider the high deductible plan. At least look at it. Now, in most places of this country, the Medicare Supplement Plan G or Plan N is less than $130 a month. In some places, it's less than $100 a month. Now that's for full coverage, where you can spend a year in the hospital and not pay a dime. With a high deductible plan, you're going to pay the Medicare Part A deductible if you end up in the hospital for a few days as an inpatient. The Medicare Part A deductible is almost $1,500. Now that's a per event deductible, not an annual deductible, and that's if you're an inpatient. If you're in the hospital for observation, that's covered under Medicare Part B, and the cost can be much higher. If you live in an area of the country where one stay in a hospital will wipe out the savings in premiums between a high deductible plan and a Plan N or a Plan G, then a high deductible plan really doesn't make any sense financially. So the bottom line, how do you evaluate the high deductible plan, high deductible Medicare supplement relative to your other choices? If you live in an area of the country where the supplement prices for a Plan N or a Plan G are expensive, again, $160 a month or more, then compare the premium of full coverage Medicare supplement plans to the deductible of your high deductible plan, which is also your maximum out-of-pocket. That way, you're comparing what you would be required to pay in monthly or annual premiums every year, whether you're sick or not, for full coverage, versus what you would pay in a worst-case scenario with a high deductible plan. If you live in a low-cost area for Medicare supplements, compare the savings in premium between a full coverage Medicare supplement plan and the premium of a high deductible supplement plan with the Medicare Part A deductible, the minimum amount that you'll have out of pocket with just a few days stay in a hospital if you don't have full coverage. That way, you're comparing what you would save in premiums with a high deductible plan versus how much savings goes out the window with the cost of one average hospital stay. What is your risk? So for example, you might save $500 or $700 a year in premiums with a high deductible plan, but lose all of that savings and more with just one hospital stay when you pay a per event deductible of almost $1,500. More if your hospital stay is not as an inpatient. That's not what I call a good value, and it's not a good risk to take at age 65 or older. So there you have it. Once you decide to go with a Medicare supplement plan, consider your personality when choosing the Medicare supplement plan for you. Are you a saver, or are you a person that prefers peace of mind? If you're going to consider a high deductible plan, there are places where that plan is an obvious value, a no-brainer. Still, use the process that I just outlined to help you determine if it's a good value. A low premium isn't the only consideration. From my experience, too many people think the low premium of a high deductible plan means that they'll save money, only to be unpleasantly surprised by more medical bills than they can afford when they do get sick. I know that was a lot of information, and I hope you can put it to good use by calling us at MedigapSeminars.org so that we can help you through this process. Now it's your turn. I make these videos for you. YouTube ranks these videos based on the number of likes, comments, and people who subscribe when they are watching this video. If you found this video helpful and you believe that others would too, then please press the like button and hit the bell icon and subscribe so you'll be notified when I publish more videos. And then please leave a comment, anything. Let me know which kind of supplement person you are, Plan G or a Plan N. So when you like, comment, or share this video, you help me and you help others who would benefit from watching this video as well. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.